New this morning, ZocDoc, the service that allows users to schedule doctor's visits with physicians across the country, is introducing a telehealth solution that is meant to help providers offer more virtual appointments as people around the United States remain under shelter-in-place orders. This service is powered by Twilio, which is a cloud service provider. And joining us right now to talk about it is Oliver Kharraz. He's the founder and CEO of ZocDoc. Also, Jeff Lawson, who is Twilio's co-founder and CEO. And gentlemen, it's good to see both of you.
Thank you very much.
Morning,
Oliver,
good to be here.
Thanks. Good. Oliver, why don't we start off talking a little bit about what this program is and why you're launching it right now. I think doctors won't have to pay anything to sign up for this service, correct?
That's correct. It's completely free for doctor, and what it is a telehealth service that a doctor can use for all of their patients, whether they book through ZocDoc or not. The doctor doesn't even need to be part of the traditional ZocDoc offering and be available in the marketplace to find new patients. And what we've found is as we started offering telehealth on the marketplace, that doctors used all kinds of different solutions, which we're happy to support, but they were frequently not satisfied with them for a host of reasons. And so we created this HIPAA-compliant, scalable, easy-to-use, and secure solution.
In terms of what is happening to practices right now, I can only imagine that doctors are in pretty difficult situations. I know here it's been 2 months. Nobody's gone in for any doctor's appointments if it's not an absolute emergency. What do you hear from doctors right now, and how much pressure are these practices, these private practices, under?
So initially, they were under enormous amount of pressure and really saw volumes decline very significantly in lockstep with the lockdown. And what we've seen is that many of them that had previously not considered telehealth, which was a fringe phenomenon on the ZocDoc platform, then quickly switched over. And now telehealth is 30-40% up from zero in February, essentially. And what it turns out is that both doctors and patients really like telehealth. And we believe that this is something that's here to stay. And, the crystal ball here are the states that have already reopened, where we see that in-person volumes have actually come back to pre-COVID levels. But we see an additional 20-25% of volume that comes in through telehealth.
Hey, Jeff, you've got some of the heavy lifting that you're responsible for with this. I would imagine this is such private information and things that need to be protected so closely. How do you make sure that you don't have troubles, let's say, the type of troubles that Zoom has run into while lots of people are getting on, and then they find out that there's all kinds of ways that some of that data can be compromised?
Absolutely. Private health information is incredibly important to protect. And that's why we've spent the last 18 months or so making our platform HIPAA compliant, which was something that we announced early this year after a great deal of work. And so what does that mean? It means that we take all information and we ensure that it's encrypted when it's in flight, when it's moving between computers, and when it's at rest, if it's ever written anywhere. It also means we have medical-grade access controls to any data so that any access by an employee is strictly controlled and logged, just like it would be if it were at a hospital or an electronic medical records company. And so our platform is made for this kind of workload based on the fact that we can be embedded into a solution like ZocDoc, but also because of our access controls and data encryption are made for HIPAA-type workloads that keep protected health information secure.
Hey, Jeff, I can only imagine the increase that you've seen in terms of traffic. Everybody everywhere is trying to figure out how to do everything from home and online. What kind of increase in traffic have you seen, and how do you handle that surge?
Well, we have seen tremendous growth in some of our products, and video is one of those, as so many workloads have moved from face-to-face to tele workloads, like in the healthcare industry. Our video product, we've seen an 850% increase in the simultaneous users since mid-February. And that just shows the number of use cases, the number of scenarios, whether it's medicine or whether it's distance learning and a number of other types of workloads that have grown so explosively because of social distancing and COVID. And our platform is designed to be able to scale out in real time to support these growing workloads so that any company who's building on top of Twilio doesn't have to worry about making sure we can keep up with their scaling needs. That's what we serve our customers. That's our expertise. And through this COVID crisis, the Twilio platform has really provided three things to our customers that they have needed. One is digital communications, digital engagement, As we've moved so many of our interactions to digital, that's what we provide. Number two, software agility, the ability to build quickly and reconfigure your business for the needs during this time as the needs are changing rapidly. And the third thing is cloud scale. You don't have time to capacity plan and rack up servers. What you need is to build a solution, light it up, and have it automatically scale to meet the demands of your customers during this time. And that's what Twilio provides.
But very quickly, have you had to add to the number of servers you have out there? I mean, if you're seeing an increase in that product of 850%, you just had the extra storage sitting around, or you're adding more and more computers and more data storage spaces?
Well, our services run in data centers all around the world. We have 30 data centers around the world, and those are in the cloud, so they can burst up and burst down as needed. And so we have the ability to expand our services, not just adding servers, but our capacity is growing constantly by the minute based on real-time customer demand that we're seeing.
Mm-hmm. Hey, Oliver, just in terms of the doctors, if they're not paying you to get part of this service, I mean, that's incredible that you're offering that to them right now in probably their greatest time of need. But how do you make money? Will you eventually charge for that, or how else do you get paid?
So our plan is to make this free permanently. Now, we have other offerings like the ZocDoc Marketplace. So if a doctor want to see their own patients, that's great. But if they also want to grow their practice and attract new patients to the platform, we have a fantastic offering for that. And it's obviously tightly integrated if they so choose with the ZocDoc video service.